my name is Carrie Sheets. I'm a nurse practitioner student. Today I'm going to be doing a range of motion exam on myself, and then I'll bring my patient in and do a musculoskeletal exam. So first I want to discuss the importance of inspection in an assessment. That's checking for obvious deformity, symmetry, any malalignment within the body, or skin changes. Next would be palpation. This is important so we can identify any bony prominences, any joint landmarks, tenderness on the body, warmth in certain areas, or edema or bogginess. Last but not least is the strength testing portion. This is tested primarily through the range of motion. Range of motion is tested on a scale of 0 to 5. So 0 would indicate no muscle contraction. 1 would indicate a trace of the muscle contraction. 2 would indicate any active movement with gravity eliminated. 3 would indicate active movement against gravity. 4 would indicate active movement against gravity with some resistance. And then 5 would be the strongest with active movement against full resistance. So I'll start with the range of motion on my fingers. So fingers would be flexion, extension, adduction, and abduction. So adduction is always going to be towards the medial part of the body, and abduction is always going to be away from. So moving on to the wrists, this would be flexion, this would be extension, radial deviation, and ulnar deviation. And then for the elbow, tilt this down a little bit. So flexion, extension, and then this would be adduction and abduction for the shoulder. For the neck, this would be flexion, extension, extending all the way up, and then rotation to the right, rotation to the left, lateral movement to the right, and lateral movement to the left. For the spine, this would be flexion, and this would be extension, and then this would be rotation to the right, rotation to the left, lateral movement to the right, and lateral movement to the left. For the hips, this would be flexion. Oops, let me scoot this back a little bit more. So for the hips, flexion, extension, and then this would be adduction, and this would be abduction. And then for the knee, this would be flexion, extension. Let's see, let me move this down. Okay. So then for the ankle, this would be plantar flexion, dorsiflexion, inversion, and exversion with outward pointing. The toes, flexion would be downward, extension would be upward on the toes. Okay, so for the next part of this exam, I'll bring my patient into the room. All right. So first, I would practice hand hygiene and introduce myself. So my name is Carrie. I'm a nurse practitioner student. I'm going to perform a musculoskeletal exam on you today. If at any point during the exam you feel that you need a break, you ever need tenderness or pain, just let me know.
Okay.
And can you please confirm your name, date of birth, and age?
Dumitru Gotonaga, February 3rd, 1988, and I'm 37 years old.
Okay, perfect. Is it okay if we continue with the exam?
Yes.
All right, so we'll continue on to orientation. So Dimitri, can you please tell me where you are right now?
I am home.
And what city are you in?
I am in Las Vegas.
And what year is it?
2025.
Okay, perfect. So then I would do my general survey portion of the exam. So my findings would look something like Dimitri is a healthy 37-year-old male. He is alert and oriented ×3, pleasant, cooperative, well-groomed, skin is warm and dry, and appropriate for ethnicity. No acute distress noted at this time. So Dimitri, throughout this exam, I'll be demonstrating how to do these tests, and then I'll have you follow. Does that work?
Okay.
Okay, so first we'll start with the shoulder and rotator cuff. First, we'll start with some of the muscles that are found in the shoulder. So you have your supraspinatus, your infraspinatus, and then your teres minor. So the first exam, Dimitri, if you wanted to watch, is the Hapley scratch test. So with this one, you'll reach behind, scratch. Other side, reach behind and scratch.
Okay.
Okay. Any pain or tenderness with that?
No.
Okay. The movement looked fluid and symmetric. Moving on to the drop arm test, Dimitri. So for this one, this is testing the rotator cuff again. Typically, if there was an injury to that rotator cuff, most would not be able to, one, lift their arm up, or two, they would not have the controlled movement down and their arm would just drop. So for this one, I'll have you lift your arm straight up in the air, lower it down in a slow controlled movement all the way down to the top of the thigh. Same with the other side, please. Good. Any pain or tenderness?
No.
Okay, so that movement looked slow, well controlled, and smooth. Now we will move on to the carpal tunnel exam. You can have a seat. So the first test is going to be the Phelan's test. This test is going to look like a reverse prayer position. So you would hold like this for a full 60 seconds. For the purpose of this video, we will not make you hold for that long. But I would then ask you at the end of that time if you have any numbness or tingling in your first 3 fingers.
No. No numbers.
Okay. So that test would be negative. Moving on, another carpal tunnel test. Excuse me, would be the Tunnel's test. So this is where I would palpate over I would tap over the nerve medial to the ring finger on either wrist. If the patient experienced any numbness or tingling while I was tapping, this would be a positive sign for carpal tunnel. So we'll do that now. He would be resting his wrist medial to the ring finger, tapping. Any numbness or tingling?
No.
Okay. Same on the other side, tapping.
No numbness or tingling.
Okay. So that test would be negative as well for carpal tunnel. Next, we'll move on to examining the spine. Dimitri, if you would not mind standing for me and facing the wall directly in front of you. So for this one, I'm going to start with inspection. I'm going to inspect the spine. If I notice any asymmetry, just right off the bat during inspection. Then I'll palpate. So starting at the cervical region, I'm going to palpate on the spine, going all the way down, feeling for any bony deformities, any pain, tenderness, or asymmetry. Excuse me. Next, I'm going to look at the paravertebral muscles on the outside of the spine, starting again at the cervical and working my way down, this time looking for pain, tenderness, any muscle spasms, muscle tightness, anything like that. So we'll start here, work our way down. Dimitri, any pain or tenderness?
No pain.
Okay. So then we're going to look at the sacral iliac. So the sacral iliac is going to be located kind of where you have the back dimples on the lower back. checking for, again, any asymmetry in this area. Okay, and then now, Dimitri, I'm going to have you bend over, touch your toes, let your arms dangle. Perfect. So now we're going to be looking at the curvature of the spine. We're also going to be ensuring there's no sacral winging present, which the spine looks a normal curve, no deformity, no asymmetry, any pain or tenderness.
No.
Okay, you can go ahead and stand. Okay, so then next we're going to be checking for radiculopathy of the back. For this part of the exam, Dimitri, I'm going to have you lay flat on your back. Well, let me move this. Perfect. Okay, so can you see? I'm going to start by raising your leg about 60 degrees. Any pain?
No.
Okay, so then I'm going to have him dorsiflex his toes, which just means toes to nose. Any pain?
No.
Great. And the other side, same thing. We're going to just straighten it first. Any pain?
No pain.
Okay, toes to nose.
No pain.
Dorsiflex, great. So this pain you would be feeling would be in your back. And you said there's no pain present, correct?
Correct.
Okay. So then we will be moving on to the knee joint. So there's going to be 4 different tests for the knee joint. We're going to start with the varus test. That's going to be testing the LCL. So for this one, I'll be lifting your leg. This ankle is going to go internal. I'm going to support this knee. Any pain with this?
No pain.
Okay, go ahead and relax. And then the same for the other side. Again, supporting the knee, bringing the ankle inward.
No pain.
Okay. So again, that's the varus test, testing for the LCL ligament. Next would be the valgus test, and this is testing the MCL. So we're going to do the same exact test, except we're going to be supporting the knee and putting the ankle external. Any pain?
No.
Okay. Again, with the other side, external, any pain?
No.
Okay, so one thing that I would be looking for as a provider is any movement within that knee area. You would notice if there was ligament damage. So next we'll be checking the ACL and PCL drawer test. So for this one, Dimitri, I'm going to have you bend your legs. Great. And this one. Okay. So I would be sitting on the toes. I'll apply pressure to the top of the tibia fibia area right underneath the knee. And then I'll be pushing. Any pain?
No, no pain.
And then I would be pulling. Any pain?
No, no pain.
Okay. It's a little bit hard to show on this couch, but I would be sitting on the foot of the other side as well. Again, above the tib fib region right here, right underneath the knee, pushing, pulling movements. For this one, I'm ensuring that there's no abnormal movements within the knee as well, indicating some ligament damage. So for these movements, we're testing the anterior and posterior ligaments of the knee. The last test that I'd like to do is the McMurray test. This will be looking for meniscus tear. So for this one, Dimitri, I'm going to have you lift your leg, and then I will be internally rotating the ankle. I'm going to apply a little bit of pressure onto your knee, and I'd like you to return that pressure back, okay?
Okay.
Okay. Good. Good. One more time. Good. And the other side. Any pain?
No pain.
Okay. Good. So as a provider, I did not feel any clicking, popping, and the patient did not experience any pain for this test. So that would be negative for a meniscus tear. The last part of this exam, Dimitri, if you wouldn't mind sitting, we're going to be testing for deep tendon reflexes. Would you mind scooting over that way just a little bit? Thank you. Okay, so we will start with the bicep deep tendon reflex. So for this one, you'll find your ligament right kind of in this bicep area, right in the antecubital region. So you want to hold that ligament taut. Make sure that the patient is relaxed. Apply pressure with your thumb and strike right over your thumb. Okay, that would be about 1 plus. And then over here, again, find that ligament. Ensure the patient is nice and relaxed. Strike over the thumb. Okay, about 1 plus. So that bicep deep tendon reflex is testing for the C5 and C6 nerve. Moving on to the tricep, which is testing the C6 and C7 nerve. I'm going to have you hold your elbow at a 90 degrees. Ensure the patient's nice and relaxed. Right above this elbow, you're going to find that ligament. And then you're going to apply striking pressure to your thumb. You'll be looking for movement in the hand. Okay, again to the other side. Yeah, ensure the patient's nice and relaxed. Strike. Okay. And then for the brachioradialis, I'm going to have you rest your right wrist. Okay. So the tendon is located right above the thumb. We would find that. Again, ensure the patient's nice and relaxed. Okay, 1 plus. Right above the thumb. Okay, 1 plus. Next, I'd be testing for the patella. It is a little bit difficult to do as the patient does not have his legs completely dangling at this time. Typically, you'd want the legs dangling and the knees a little bit out from the table. So you'll find your patella right underneath is going to be where your ligament is, and this is testing the L2, L3, and L4 nerves. Okay. The other side, again, right underneath that patella. Ensure your patient's nice and relaxed. Legs would be dangling, knees would be out from the table. Okay. And then last but not least is the Achilles. So for the Achilles, I would be holding the patient into a dorsiflexion position. This is testing the S1 nerve. And so holding the patient, we're looking for the foot to react downward, which would be positive. I'm going to strike that Achilles tendon. Okay. Same with the other side, dorsiflex those toes. Okay. All right, Dimitri, thank you for participating in the musculoskeletal exam. You're a very good patient. I appreciate your time.
Thank you.
Thanks.